All right, so now the muscles of the foot. So what I've got laid out here are four sketches. You want to freeze frame this and sketch these out before we take on the muscles. So be sure and do that. We've got four different views of the foot with the bottom foot to the bottom right. And the rest are, we have a lateral, we have a medial, and we have kind of a back lateral view to give you multiple viewpoints of working these muscles. So now we get the daunting task of putting on the relevant foot muscles. And there are many more than we need to know. There are plenty of muscles in between the bones, the phalanges, and also the metatarsals. But we're going to start out with that bursa sac down below. We'll go easy here. So that bursa sac down below is a frictional device that helps to separate the Achilles tendon coming down and attaching to the calcaneus bone down in through there. So that will help with friction, and it's located right on that head, that tuberosity of that calcaneus bone in through there. Little bursa sac. So the tuberosity can sit on top of the tuberosity, and then the tendon will sit right on top of the bursa and then attach to the bone itself. And so it gives it a little area to protect itself from friction and from wear and tear. It already gets enough stress on the feet. The foot is a pretty stressed area. So now we come down with the tendon of the Achilles here, and I've broken the pencil, gotten it out of the way early, and now we can start on another one. And so I'm going to bring down that Achilles tendon from the soleus and all again from the gastrocnemius all the way down that graceful little elegant area at the back of the foot, and it's going to give a little space between the tibia and the fibia back there. And that is classic look to the foot. So I'll just start to fill this in further to render this out, to make this a cleaner rendering. Because ultimately the trick is you want to be able to visualize the muscles of the foot and the bones and the actual structure. So the most important of all these is that triangular wedge structure, which is built on the bones. And you want to remember their names, but over time, unless you're constantly going over the names, you'll probably forget some of these because they're pretty complex to remember. So I'm just going to render in just a little bit of back of this tibia and fibia area in through. That's kind of where the fibularis brevis and longus will be in a moment or so. And so we'll bring up now the Achilles tendon off the soleus and off the gastrocnemius together, and they both come down and connect to that beautiful and also strong cord. You can see it just about on anybody, no matter their size or shape or the amount of fat that they have. Overall, it will show up in that area. It's pretty lean in through there. Now coming over to this above medial view, you'll see that tendon come on down and end, get a little wider as it comes up, and then as it comes down it gets a little narrow and fits right, nestled right in that tuberosity groove in through there. And so we see that sheath and come on down to that back of the calcaneus bone, which later on will have another fat pad attaching, covering around it to help with the sheer weight of being crushed and stomped and stabbed, and that so often happens. Here we go. So now we're kind of rendering this out a little further. So we're going easy so far to make that feel right, get those easier forms in. So don't be disheartened if you forget some of the names or if you forget some of the shapes or forms for a while. It takes a little practice to get that. All right, so now we're going to pick it back up with the extensor digitorum brevis. And so these muscles sit right on top of these cuneiform muscles in through here, and they're extensors. And they're kind of make this larger little grouping, but they're separated into three muscles. And we're also going to draw the extensor digitorum the brevis muscles, and then also the hallucis extensor hallucis brevis. That's what I meant to say. See how you can easily get tripped up in through there. Even when I'm teaching and I get tripped up, don't worry about it. So these all make a little pocket of four little finger-like muscles that sit in that cliff or that wedged area we talked about in foot structure that sits and falls downward. So that fills in that gap a little bit and makes that wedge a little bit more even. So I like to teach the wedge more angled, and then when we fill in the muscles, it's not quite as angled. So we can separate these muscles out, the extensor digitorum brevis here. And these are extensors. On the bottom of the foot, those are the flexors, just like when we talk about muscles with the legs too as well. So they're sitting at a little bit of an angle, and we're going to separate them in through here. They're attached to the calcaneus bone, believe it or not, roughly in through there. And then they tendon out to the second, third, fourth, and fifth metatarsal. And they come on out, and they'll tendon out. They won't go all the way up to the distal phalange. The extensor digitorum longus, remember that's attached. How about all these names, right? Remember that's attached to in that little pocket area between the interosseous material between the tibia and fibula that sits in there, and that gets mostly covered up by the tibialis anterior. Those tendons will run really long through the second, third, and fourth, fifth, all the way through the tip there. So just keep that in mind, as we're going through and as we're working our way through these muscles. So I'll give you a little chance to kind of catch up and look a little bit and think about what we're doing here. So now we're looking at those tendons, and so the tendon will begin to sheathe over the second metatarsal and end about where the head of that area is. I'll darken this in a little bit so you can see that. It's important to be as clear as we can. So these are the extensor digitorum brevis. These three, and we've got one little small one that's gonna go to the big toe. So these tendons are coming off the extensor digitorum brevis here. Okay. So 2, 3, and 4. And if you forget, don't worry. It's okay too. I just want you to just feel this big muscle through here. That's okay, because all these tendons, there's these tendons in here, then the extensor digitorum longus will have tendons at 2, 3, and 4. Will go underneath that and go all the way. So I'm going to show you that in a moment too. And they'll go all the way to the distal. And then the extensor hallucis brevis will go all the way to the big toe as well. So that's important to realize and understand as well. It's like somebody's playing music in the distance part of the background. So if you hear that, as I overdub this, makes actually the video go a little bit easier. I can actually overdub and have a little bit better sound quality. And actually the drawing goes a little bit quicker. So I'm not when I'm making this drawing, I'm actually not talking while I do it. Most of the time I do that, which is pretty challenging. But here I'm actually overdubbing, so I can draw a little quicker. So now this muscle is the extensor hallucis brevis in through here. So we're getting that to come over now in this notch and through here. Notice how they all stay well within the peak of the angle of the wedge. They don't sit beyond it, and that tendon will start to come down now and sheath over and come on through like so. And we have another tendon that will just go all the way to the head through underneath there, to the distal head. So just know that every toe, both top and bottom, will have tendons that run all the way through to the length of them to flex and or to extend them as well. So that's moving down on this angle of the foot. It gives that foot a little fullness. Now a little more fullness in that top area. Okay. So now we're coming down through here with the fibularis longus brevis area right in through here. And they'll come down and really tendon out, go behind the the fibula. Remember that. So the brevissum will attach the fifth metatarsal. You'll see that on the model. You'll see that tendon oftentimes. It won't be a vein. It will be actual tendon. You'll see that quite often. It'll give you that. It'll give that fibula a little bit different and unusual shape, and that is a tendon right in through there and underneath and through and around, and it comes over and attaches to that back part of that the tuberosity. Now the longus will come underneath the foot and go all the way over to the base of the condyle of the first metatarsal, all the way underneath the foot, and come through the parts of the bones. Just remember that in between all the phalanges and the metatarsals, there's interosseous material or ligament-like material, but there are also muscles in between there. We don't need to know all those. It's not important. So now coming from the extensor digitorum longus in through here, we don't see a whole lot. I'm going to show you just a little bit right there. We see a little bit where that will get bulky, and that's the part where I actually see most of it gets covered up by the tibialis anterior. We're going to see these four tendons from the longus muscle come underneath, and they'll tendon out 2, 3, 4, and 5 all the way through. So I'm trying to show you there as it's coming underneath, and then we'll just draw the tendon on top. It will come all the way to the distal area of the phalanges, right in through there. So these will, and those tendons, depending on the model, depending upon fat deposits on the foot, which we have for padding, you can see a lot of these tendons quite a bit, and it gives you a kind of angular beauty, if you will, to the foot. The foot's real lean. It's not a fat foot. It's a leaner foot, and through there. So we've got just about everything we need on this view except for the outside here. So the outside of this foot on the lateral end is an interesting muscle. It's the adductor digiti minimi. I'd say that 5 times. So this is the adductor digiti minimi. Okay, think of it mini-me, the mini-me. Adductor ADD digiti minimi. It's attached to the calcaneus bone, and it's a little flatter here. So it sheaths the calcaneus bone, and it sheaths over the fifth metatarsal, but it doesn't end there. It ends over at the end of the metatarsal, over kind of where I'm talking about a little bit in through here. So to slow this down, there we go, and it sheaths over, and then really kind of tendons out and ends in through that area. It stabilizes the lateral edge of the foot, helps with adducting, bringing the foot in to itself, kind of curling it in through, and it gives a little fullness to this area. It's not the fatty pad of the foot. That's still to be determined. That's more on the bottom and a little bit on the blockier side of it. Some people have really pronounced fat pads. I've seen in athletes of all ethnicities where they have super strong and very almost like big block-like fat pads on especially the lateral ends of their feet. It's amazing. American football players, especially basketball players, where the feet really get a pounding, but most sports do. They get a pounding. International football, soccer, which maybe one day our men's team will be good. It would be nice to go to World Cup and for the Americans to actually be really good one day, maybe. Our women are great, so for all you other folks out there that have great men's teams, I envy you. And you know who you are: Brazil, Germany, France, Italy, England. Okay, back to foot muscles. Okay, so now let's find these muscles on this more kind of a stabilized lateral view. So there's the extensor muscles, the extensor digitorum brevis, the three of them grouped together, and I'll separate them in a moment, and then the extensor hallucis longus, which will be very difficult to see in this view, right up on the top edge, and then the tendon will go down to the down onto the metatarsal, but not all the way. Won't extend all the way. So there's the three through there, and then we can put the hallucis brevis on if I remember if I did that. But yeah, there it is. So coming down a little bit. They're kind of like torpedo or cigar shapes, or the serratus anterior muscles. A little bit, I suppose, but they're shorter, and then they're tendons coming down to the metatarsal edge in through. And I'm just going to draw the tendons of all these to include the extensor digitorum longus tendons that will go underneath as well. So the main point of this is where they sit, what they look like. They're a little bit angled back in medially, and they separate, but you'll feel them all together, and they give bulk to the foot. And tendons run through, again, all the phalanges, through the metatarsals down through all the phalanges too as well. Whether they're the brevis or the longus, it doesn't really matter. It doesn't really matter to me, but they sit on top, kind of in the middle of those toes, and you'll see them on your hands too as well. So that area is the extensor digitorum longus, where it would make an appearance just a little bit there, and then it would tendon out and then come on down and catch these here on the bottom edge here. Run all the way through on top of those bones. One thing I haven't mentioned yet, I'll draw it in a moment, is all the condyles where one bone, a phalange, comes into a metacarpal. They get lots of ligaments to make them bulge out. That's the tibialis anterior there. Okay, and it will turn and go underneath and attach back to the first metatarsal underneath its base and through there. All right. So we're putting those muscles on top, filling that out a little bit further. Okay, kind of cleaning up this fifth a little bit so we can see it. It's going to come into play. It's got that little edge, and then we have the tendon from the brevis, the fibularis brevis, curving around and attaching to the fifth metatarsal. See how easy it gets when you start to memorize it. It takes a little while to memorize it. And then we have the longest tendon that will partner up and come underneath and attach to the first metatarsal too, under as well. Those get lost underneath the foot. So just know that they come down from the fibularis brevis and longus, and they fill out the fibula, sit on that medial side of the fibula pretty nicely as well. So now it looks like we've got the adductor digiti minimi to put on. Adductor digiti minimi. So there we go. So again, attaching to the calcaneus bone there, and we want to make sure that it doesn't go too high, because it actually rolls underneath the foot and attaches underneath as well a little bit. And I'll show you at the last drawing underneath. So there's the fifth metatarsal there, and it's going to sheath over that. And it's pretty thin muscle, and it will still feel that bump of the fifth tuberosity of the fifth metatarsal, that little horn there. Give us that expression. Then we start to get a foot with less of a, we still have the arch feeling, but it starts to fill in a little bit. So we have less of that arched look on the outside of our foot. Right in through there. There we go. So it's coming over and attaching to where the metatarsal ends, roughly, that condyled area. So those condyles, again, where you have metatarsal to the proximal, and the proximal to the medial, medial to distal, all those little congruences get ligaments. The entire bone, where one bone comes into the other, will get a stitching of ligaments. There are several ligaments all over the foot bones, through the cuneiform bones, the first, second, and third, the navicular bone, the cuboid, the talus, and also, so here I go, and I'm finally getting to that. So what I'm showing you here is just a little ball of ligament muscle that wraps around it. I'm overemphasizing it just so you show it. It really pulls out the knuckle, what we call the knuckles of the hand, and also the feet, those bone knuckles, especially in the great toe, in this area where it really gets pronounced. And so they're all over. I'm just going to show you one just to save time on that, but they're quite a bit. If you look at your Paul Roche book, you'll see that you'll see that quite a bit through there. So in all those areas underneath through here, etc., we'll have them. Now we're going to put on the extensor digitorum brevis muscles on now the top here, and remember they're coming at a little bit of an angle back into the medial side, so they sit as a grouping. So there's one, and they end about where the metatarsals start. Here's two, and then we'll get three, and three will get a little covered up by the extensor hallucis brevis, which goes to the big toe. The others don't. The three extensor brevises, digitorum brevis, will not go to the big toe. Those tendons will go 2, 3, 4. All right, so coming down a little bit through underneath. They attach to the calcaneus bone. That's why they're pulled over. And the hallucis will not. It's attached up a little bit and over. And so we get that through there, and it stays, and it ends about where the peak of the slant of the triangular wedge will be. So there we have that through here now. So working these foot muscles. So once you start to get it, it feels a little more comfortable. Now I'll take a little dark here and illustrate them a little bit better with the chalk and charcoal. I just feel like drawing bigger is probably easier to see as well. You can do these, those of you in the YouTube land, you can, any material you want. It's whatever you're facile with and most clear will help. My students, depends on what we say in class, I suppose. So you can see how that makes a nice connection. Now that's also, remember that transverse arc comes around it too. I'll show you that in a little bit. So where they connect up. It's kind of right where the fibula ends there, where the little calcaneus bone is open to being attached to. Those muscle forms are attached. So the extensor hallucis brevis, and there's also a longus that goes to the big toe all the way through, and the brevis is shorter. But we don't really need to know about the extensor hallucis longus, do we? The tendon will end here for the brevis, and the longus will go all the way through. And I'll just make that just known that we'll keep on trucking all the way down to extend those feet, those toes up. And we'll do a video. We'll do a lesson on just toes, and we'll put the skin and flesh on those bones. I think they're worth an individual lesson to talk about their shape and form, and also the nail too as well. There we go. And coming over with the tendons, all of them will get covered eventually. The extensor digitorum longus tendons coming underneath, and I draw a little bit. It will come down right in through here. And this is the visible part of it, right in through there. Right in through there, and the rest of it, I'm kind of making that little angle there because that's where the tibialis anterior will start to come through, and I'll show you the hollow in a moment. Those two muscles are separated down here by the end of the kind of the C-clamp part of the tibula, right in through here. So we'll go a little darker, and then let's see if I do it. It gets the tendon here in a moment. Getting ahead of myself. There we go. It's all connected there. Tendon coming down for the extensor digitorum longus. It's like a webbing of information that goes through there from the nerve. The nerves will take that information and activate these tendons and muscles connections. So that's looking pretty good. We want to get it should be at a slight angle inward. So that's working pretty well. We have that. Illustrate this muscle a little further as it turns down. And pick my color, and then now the tibialis anterior. And here I go. So there's a little hollow, and you'll see that on the model. You can see it right in through here. There's a little space, a little missing part, if you will, between the tibialis anterior and the extensor digitorum longus, right in through here, and then the tibialis will fill this in a little bit and come over. Give it a little bit more fullness and help with the gradual turning of that, and then it will turn underneath and its tendon will go to that first base of the metatarsal bone. So it's coming down. And through here, there we go. So it's coming along, we're getting through there, and so it will attach and underneath and come and basically disappear in through here and attach to the first metatarsal. Right, it's in through there. Continuing on as it comes underneath here, clearing this out a little bit. Cleaning them up, getting it clear. See how it starts to fill in now that area of the top of the foot, and it's a gradual turn from the tibialis anterior. Now we're going to put another muscle, the abductor hallucis muscle, on the medial instep of the foot here in a moment, and so that will give the finishing part of that medial part of the foot, the abductor, ABD, abductor hallucis. So on the medial part, that lateral, that longer muscle on the instep is the medial area is abductor hallucis, and on the lateral side it's the adductor digiti minimi. So just keep in mind that shows you that turn, and we have to make a little bit more of a gradual turn inside to get to the instep into the bottom of the foot, kind of below that. That's going to be important too as well. So now we're going to attach it here. So attach is kind of its partner on the other side is the minimi. Now this is the hallucis, the abductor hallucis. So it's going to curve around, and it's somewhat coming underneath now a little bit in those forms, so it overlaps inside the foot a little bit and coming over a little bit and then attaching underneath and a little bit laterally to the medial part of the not laterally but underneath the condyle there of the metatarsal to the phalangeal joint there as well. But it looks like what I'm drawing here, and that's just more important than what I'm saying. So let's give it a little bit of color here so we can see that together. And it really gives us the other side from the adductor, right? The adductor minimi to the abductor hallucis on the lateral side. And so that's a soft, roughly transition now of the foot from the top, down below as well. So I'll show you that when I shade a little more at the end. That's going to help to kind of resolve that. So this turns in through like that, and it flattens, and then we're going to I'll start to put on this fat pad that goes to the side of it also, and then and underneath it, and then start to turn and go underneath the foot and for the heel. And so that's where that goes in. So we'll make that kind of feel like it's inside, kind of molding with that, and kind of make it look like a disc a little bit for that fat pad of the heel. Right in through there. We'll put a little bit of light shadow on it to show it off a little bit further. And so in that particular area, and it starts to turn, then we'll put over here now into the area of the heel. And that's probably a little further than what it should be. That should be backed up a little bit to that the end of the metatarsal area, but that's okay. It can go a little bit longer. I'm okay with it, especially underneath. And those are going to fall over and give you that lovely kind of bottom of the foot look now on top a little bit and through there. That could probably be pushed in a little bit, but that's okay. Okay with it. And now ligaments attaching all of the joints from distal to proximal. And all the three others, proximal, medial, distal, they'll all have ligament balls. The reason I say ball, it's kind of like this spherical little ligament area. And if you take everything off, they would do that. And they interconnect in the middle here to hold the metatarsals together, so they have much less range of motion. We have much less range of motion in our feet to begin with. Okay, the big toe has been greatly minimized compared to the hand. And now we're going to get that coming underneath, that fat pad in through there. And we're getting a good feel of now of what we need. So just remember that there are muscles inside the metatarsals, in between. That's really important. Now we'll get that fat pad here on the lateral side of the digiti minima. And so it looks kind of like it's a platform, and then it comes out, and then there's a flatter, rounder space finishing it down, and around and down again and through with the arrows. So you kind of see that platform. And so you get this little step area. I've seen it on athletes with just amazing amounts of padding on their feet to help protect just the amazing amount of stress and wear that they get on those surfaces. So we're coming around the heel and over and through and then downward. So it's kind of a little bit of like a extra stair step to put on that. And that's not muscle, that's fat pads. So you have much less nerves through there. You still feel, but you'll feel it much less. We get calluses on those forms of the skin, not the pad itself, but the skin. So that gives you an idea of what's happening with that. And then we'll put it on over here on our true lateral kind of side view here underneath, and see how it runs across and gives us that. And you're still going to feel, even with the fat pads, you're still going to feel the fifth tuberosity, the fifth, poke out a little bit further as well. You're going to feel always that bump on the side of the foot coming out. All right, cleaning up here a little bit. So, and it's a little ridged, but it'll smooth out with skin and material on top with those digitorum brevis muscles and the hallucis brevis extensor there. They'll smooth out a little bit. So cleaning up this a little bit, that turns and flaps over, so we still want to feel how that gradual turn, transverse arch there. So we've got a good shape going now of the foot. If you get everything working pretty well, the shape starts to make sense. And we have the minimi there, the adductor digiti minimi on the outside, adductor on the outside, ABD on the inside. Here we go. That's it. Turning that through and over, turning it over. There we go. And then cleaning up this space. So I'm just pointing there to remember to tell you that there are muscles in between here. Unplanar underneath and on top of. They fit in through here in interosseous material to hold all that together. We don't have web feet, but there's mere material in between there that hold that together pretty strongly. So I think we're about ready now to go on to the bottom of the foot and start to finish out that. So now on to the bottom of the foot. So interesting viewpoint now of the foot, very bottom foot looking on top of it. And first thing we want to start out with is this long plantar ligament that attaches to the calcaneal bottom here and somewhat inside. And it's going to run up into these base of these metatarsals and push a little bit more to the smaller toe, to the fifth metatarsal rather than the big toe, because we still want to feel that gradual fall down from this area where I'm drawing here all the way to the middle inseam of the foot in through there, so that gives it that gradual turning. So this is the ligament that sits underneath, that's binding these bones together from the calcaneal bones, cuneiform bones actually, to the calcaneus in through this area. So I'll blend this in through here so you can see a little further in color. Strand that in, and then you're going to have muscles sitting on top of that, the flexor digitorum brevis, which will sit right on top of that form and create a little stronger head. and create a little interest and help with the fat pad, but then as we get more to the medial, the center part, create a little kind of striated sort of hollow that you'll see when you see the bottom of the foot. So it gives a little bit of kind of ridging and turning, and I'll show you what that looks like a little bit in a moment. So we've got that plantar ligament in through there, and then we're going to put that bursa sac on this view, which I forgot to put on. We'll see a little bit of that right in through this back area and bulge out, because remember, we're looking now down onto the bottom of the foot, which is a pretty challenging viewpoint. And so now we'll put the heel fat pad onto that. It'll catch its shape a little bit and be a little fatter as we have padding going on to it. There we are, moving around. Give it kind of a thickness too. And then we're going to see some of that fat padding over here. Now we're going to need the digiti minimi, and we're going to need the abductor hallucis too as well. We'll put that on in a moment, but we'll start to see how we can get a nice good look at the bottom of the foot going pretty easy. Just showing you some things that are relevant down here, that sloping from that fat pad and then into that tendon and that muscle, which will be the flexor digitorum brevis coming up, and it will go a little bit further and tendon out and make tendinous connections to these metatarsal bones, and then outward and all the way through. But you see those tendons far less, they get covered up by that. So they really, like I said, my fingers, they really come out through that area, and they come up and they attach to help the foot flex. So these are flexors. The front of the foot, the top of the foot are the extensors. Working that pretty well. And we're getting this feeling to show you that it's starting to curve and turn. These muscles get flayed out a little bit, and we'll start to show you now that they'll curve underneath, and that moving long ways that direction, but also falling across the form too as well, and connecting to those tendons. Again, with this point of view, the fat pads are the big key. That footprint, that wet footprint or footprint in the sand, make a huge statement of formation. So tendons come out through here, these muscles, not the ligament, but the muscles, the flexor digitorum brevis. And all these ultimately will have tendons that come through. So now we have the adductor here, digiti minimi. Remember, we're on the lateral side, so adductor, digiti minimi. The minimi are just adductor, even if you want adductor of the foot, if you want it, which is okay too. But adductor, digiti minimi, just really important here, and coming over. And you're going to see it on the bottom here. So see how I'm covering up the bone a little bit there. It's going to get thicker down there by the ligament in the head of the calcaneus bone. So it's a little thicker coming through, right in through there. And then it starts to kind of V out a little bit in through here. Just give some fullness to not only the side of the foot, but also slightly the bottom. And really those two muscles there with the fat pad make up the outer edge of the fat pad there and through there. And it attaches up by the end of the condyle head. So we get that. And then as the fat pad goes across, don't forget that turns in, turning underneath the foot here. We're really curving and turning in through here. So we're coming around the bottom of the foot. It's like somebody's trying to kick you in the face. And we don't want to forget that fifth metatarsal tuberosity, that little point. I'll show you that in a moment. So we're curving that in, bottom of the foot. It's a gradual turn in. It's flatter, but it's also curved. back down in now, so that's tricky. So you can, feel the bottom of your foot or your significant other or whomever. Tuberosity bulging a little bit. We'll see that with the fat, but it'll always bulge. Right in through there. There's the fifth. Okay, right in through there. Thanks for pointing it out. We got it. There it is, right there. Okay, and then it comes in and over. We get that through a little bit. And so now we're coming up and we're going to get that fat pad. It move up even further. And now we're going to feel a little bit of that flexor digitorum brevis and that plantar in there underneath the foot and that fat pad coming around to separate those a little bit further. Gradual turning in through here, gradual moving, coming around in through here. A little separation. We get the calcaneal bone. Now I'm talking about the abductor, ABD, abductor hallucis. So the hallucis now again connects to the calcaneal bone, and it's going to run into that first metatarsal knuckle area of the phalange through there. So let's draw that and give some more expression to these bones. Now it's going to cover up some of these bottom bones a little bit. Right in through here. There we go. And then it's going to get a little fatter through here. So it V's out, so it's connected to those muscles pretty quickly. It's going to cover up some in through there and come on over. And then we're going to get that connection. It's going to cover up that first metatarsal a little bit, and then it connect up right in through here a little bit and further and on over. So we get that connection moving for us. And see how they all come together into the calcaneal area really strong. It looks like there's a tripod of muscles that come through really, really strongly through there succinctly. And so you get that very dominantly, and it curves over. And so all that wants to turn and sheath. So it's not a straight, it's like the antithesis of the underneath arch of your foot. This is now the bottom curve of that foot. So we've got that going with those muscles. And they're deeper muscles than that, but we don't really, they're not going to come into play. So I'm not going to put you through to know them. I don't know them. So I don't know anything anatomically for the most part about drawing for the muscles I don't need to know. There's too much to know, and whatever it is I don't need, I don't bother with. So turning foot, turning underneath, all this now, tendons coming through all of this here and all the way through underneath. Remember, they're on top of the toes too, so we can flex and extend. Wiggle your toes up and down, and you need a different muscle and a different tendon for that to work out for you, to work that pretty well. So you get that curve going through. So we're getting close now to putting on and getting the final look of the foot of what we want to know. And through here, curving underneath. Let's work the fat pad up further, coming through and over and sheathing over the metatarsals and ending about with a condyle. As I've got the front foot, the one right above it, that fat pad on the toe is a little too long. That's okay. I can get away with it in that view. So they sit over and see how they slope, high point roughly at the second toe, and then they break in a little bit, coming down this gradual praying. There's kind of a pocket. We've seen that on the volumetric foot where they make a kind of they have a definitive top and a side to them, curving in like so. And these fat pads sit on top. They're one of the final layers of material. It's like insulation. And they sit up there, and we'll start to feel just the shape of the toes coming in through here. More triangular here, the big toe, and leaning in to the second. Everything leans in roughly, remember, to the second toe. I'll try to draw a little higher. And we have the third toe. It's rounded a little shorter, mostly. And the fourth toe starts to lean in further. But we're looking for that competent footprint. And through here we go. And then the pinky toe is more triangular and leans even more so. Everything leans to the second toe. So we're getting close to finishing out what we need. So let's render out a little further here. See what we have left. But 3-4 minutes left. I'll just clean this up and talk a little bit, make it a little clearer and cleaner. So practice these. Practice these very simple diagrammatic views: forward, side, front, back. And as you get more familiar with them, then try different positions like this to help you out even further, seeing them in more dynamic positions. And the reason why is we're not gonna look at the human figure as a very stiff form, front, back, side, etc. We're gonna see these in more dynamic positions. So you really want to see everything in more dynamic diagrams. You've got diagrams in your books, the books we use, the Dr. Paul Roche, and that's why the Robert Beverly Hale book is so important, because it gives you master studies to look at the dynamics. But I think diagrams are what you can always bank on and go to, and then be more dynamic from that. So what I'm trying to show you here is a soft transition through this material, up and up. It's not a hard line. There's no hard line here, so it's softer. Be careful. Softer transition as we get to the top of those extensor muscles, digitorum brevis and the extensor hallucis brevis, and through there, tibialis anterior. And we get a softer, gentler sloping edge. And then if you look right underneath it, the bottom of the foot that we see there, that softer slope into the fat pad or the sole of the foot as well. Pretty important to see and make those distinctions so that you get not only drawing understanding, but you get understanding that works for anatomy and for aesthetics. Aesthetics will guide your anatomy. Sometimes we take anatomy off, or we minimize anatomy at times when we don't need it. You don't want to overemphasize everything. Look at the drawings sometimes of Palaiuolo, Italian artist, or Uccello, and when they're studying anatomy and they make active drawings, and every single muscle that they can think of the body is flexed, and the figures look like they're in a spasm of some sort. So we want to only emphasize that which we need at the time of flexing, and then relax others to make aesthetic design decisions, which is really important. So the understanding of anatomy is more than just the knowledge. Understanding the form through drawing is really important. Just showing the turn of the foot there. And notice here, we're coming up, and they get these little, in between the fat pads, they get a little flatter there. I'm making a little distinction to show you there, and just kind of waxing philosophic. All right, I think we're now there with our anatomical exploration of the muscles of the foot. Next step we want to do is to go on with the toes and look at them individually as they connect to the foot, and tackle that area. All right, we'll see you guys. Take care. Bye-bye.